Ladies and gentlemen, I am very happy to welcome you on the very last session of the progress report. We have been here for 6 days right now, and we all together hear over 160 presentations with over 350 studies. But let me start bringing a little bit about, as a closing remark, why we are here. And I think our vision is very, very clear in this program. Our vision is to bring science into healthcare. And we plenty of time get the critics from both sides that why is it important, for example, for a medical doctor to do scientific activities or to have a capability of understanding the scientific results, or sometimes backwards, somebody who is at healthcare, they are maybe saying that why would be science so important. But let's just think the very basics of medicine in the 21st century. If you go to the pharmacy, why can you buy a drug? Because of science. If you prescribe a drug for the patients, why is for? Because of science. Laboratory diagnostics, why you are able to diagnose a disease? Because of science. Why there are so many imaging techniques, CT, MRI, intervention possibilities? Because of science. Why you can follow the patients currently with an evidence-based way? Because of science. In the 21st century, I cannot even quote a single moment during healthcare which is not science-based. So very, very clear that a good quality healthcare can be run based on high-quality science. And now you are in year 2, which is a different year than year 1. At year 1, you had much more time for science. You had 4 days protected time during your medical training for scientific activities. In year 2, you only have 1 day, but it's also the question which side you are looking at. Because 1 day, having protected time during your residency, it's a great achievement we could make, because until this program, it was never been officially allowed for a medical doctor to stay away for 1 day from the daily health care. Maybe I am very far-sighted, but in my opinion, and I quote it everywhere, everybody in healthcare, including dietitians, psychologists, medical doctors, should get a research or scientific day every week, because this is the only way to have protected time to look at the newest scientific results and translate it to the daily healthcare activities. As you know, you had 6 phases in the 2 years. In phase 1, actually the major aim in the first 3 months to simplify the questions, to find the most important questions, understand whether your study is feasible or not. So the first 3 months we are concentrating on the questions. Those who could see Boton Droschka presentation, he also quoted that this is the most important part of science, because the big danger is there are so many unimportant questions, and of course unimportant questions can be answered with the same methodology like in important questions, and you can still publish unimportant articles, but this is not the way we want to go. In phase 2, you learn how to write an article, how to make presentations, how critically assess your results. In phase 3, you meet really excellent international scientists to learn how they could go further. In phase 4, you are actually in the middle of article writing, and in phase 5, the most important part you had is writing your articles. Maybe it sounds very rude, but this is the honest truth, that your work does not exist until you are not published it down. There is no scientist who can be quoted, it's a good scientist, but not publishing. No. Your work only existed if you write it down and you publish it. Never of your research can be used for future perspective if it's not published. So something which is not published, not existed in science. This is as clear as it is. And I was very pleased to see that many of you already submitted their first papers, or some of you have already have available article on PubMed. In year 2, we also had an innovation concerning the PhD students, because now you not only can be a student in the system, but you can be also a teacher in the system. If you look at this pyramid, how you can retain the knowledge for longer period, it's very clear that just sitting in lectures or reading is not enough to retain the knowledge. I don't know who of you remember the Sanjurdi-Krebs cycle to write it down, or some anatomical points of the body. Because you are not using this kind of knowledge, you are not teaching. However, if somebody teaching others, this helps to retain the knowledge for much longer period than earlier. So we have the system. So you are currently the senior science methodology practitioner who is a PhD student, but those who are also starting supervising students in a methodology way, they are also going up. And of course, when you join to the Mentors Club, you also can have PhD students. And it's also inside our details that you can have really good achievement and good possibilities if you go through the system. So here are the list of the science methodology supervisors from year 2 who are already taking a large amount of teaching activities for year 1 students as well. So for year 2 students, you have 190 topics, 190 excellent questions. If you look at here, you can see about the distribution of different methodologies. Also, as a very large critic concerning our program is that they sometimes quote us as a meta-analysis factory. Yes, it might look from outside that we are a meta-analysis factory, but we are not. We are a quality factory. What is important to have quality science? What is necessary for quality science? You need an excellent questions, quality question. You need quality data, and after quality interpretation. Without quality data, you cannot have quality scientific results. Unfortunately, we must admit that the Hungarian healthcare recording system were not designed for scientific activities. Therefore, we don't have, and not only we don't have, plenty of countries and systems do not have quality structured data. This is the reason why most of the studies can be run, if you ask a good question, via meta-analysis, because the lack of high-quality data. Here are the meta-analysis and the progress of the last half a year. You can see every month that the number of submitted articles and accepted articles are growing, but still around 30% of your first studies are not published. Concerning the registries, also there is a movement in the topics. Of course, it's not as advanced as the meta-analysis part, and this is the same with the clinical trials. Altogether, we already have 13 publications for this year on PubMed, and you can see the highlighted article which are already available there when you go up. And if you look at the journal names as well, they are really high-quality journals, and really all of the questions are really healthcare-related important questions, which actually we tried during this tournament answered. If you look at this already available 13 articles, the quality, you can see clearly that this is not a meta-analysis factory, this is a quality factory, because our aim is to provide you the framework of answering your questions in really a high quality way. So this program is not a vision any longer, it's really a fact. And this is what I'm mentioning. I am so happy because yesterday we submitted an article to Alimentary Pharmacology, and within half an hour it was rejected. Of course, many times your article is really rejected for several reasons, but concerning meta-analysis, many of you were already rejected with plenty of journals. But if you look at why, there are always a couple of reasons written. One of them is the quality of the data, and the second is the huge heterogeneity of the different studies. However, of course, you can't improve the data which are already published. You can't change the past. But you can change the futures, and the futures could be like if you prospectively try to answer your questions, which give you much better opportunities. And there are two huge methodologies, one of them the registries, the other the clinical studies, in which you can actually collect large amount of prospectively collected, high-quality structured data. So I would like to suggest each of you who has a chance to start registries, to start them, because this is the only way to get new methodologies to the system. And the Center for Translational Medicine is able to help you also to develop the electronic clinical research forms and all the necessities which is needed. For the sixth phase, you always have something to do. You still will have group meetings. You have 5 group meetings you have to do. You also will have a progress report and project meetings. However, the projects meetings now not as intense as it was in year 1, not every week, but every month. You don't have a class meeting education any longer, but also there are plenty of high quality presenters coming. There are already 3 Nobel laureates, for example, who agreed to come and to assist both in this program and the other program run at the University of Szeged. And in a nationwide way. And we also have social events, which is you are more than welcome to attend. And for year 2 students, the 4 science methodology experts and advisors are who can help you at any time when you would like to go further. Of course, the diary is very structured. Of course, we tried really to have it in advance, give you the dates. You already have the 5 group days when you will have the group meetings. It's already in the calendar. And the other issue is what, please remember the complex exam, which will be between 26th and 30th of June. However, the complex exam will be a little bit different than what we are doing here, because there will be a committee, an international committee with 5 members, including statisticians, everybody, and they need to give marks, everything to complete the complex exam. I know that there were a couple of last-minute cancellation for today's meeting, especially in this last group in the cardiology group. However, please remember that if you cannot cancel the complex exam on the day when you come because you will not complete it and we can't help you in that case any longer. It's already in the diary about when the exams will be. On Monday, 26th of June will be the written exam you have to do, and actually on 30th of June, which is a Friday, will be the complex exam, the oral exam for the students who are coming. As we always refer, there are plenty of activities outside of TM, and in January, now we're going to the theater every month, and we will have different programs you can join in. And however, you need to register in advance because we need to buy the tickets, but always the most liked party is the Gatsby party, which in this year, this will be organized in 23rd of February. I always like finishing with some of the new ideas about when you go home to think about it. If I look at healthcare, community benefit science, there are unbelievable huge amount of roadblocks because there are three main stakeholders, three main areas of this issue. One of them is the discovery phase, where the scientists, especially basic scientists, try to answer an unknown question. The next part, what's happening when you publish it and put it to the shelves. The second issue, what is definitely needing, to implement the scientific knowledge and to answer the question how we can use it in the daily life. And however, this can go only for community benefits if the policymakers also understand it. So if any of the three teams, either for the discovery scientists, either for the clinical scientists who implement the decision, or the policymakers not on the same boat, the results which coming from the science will not be used. And there are, as I mentioned, several roadblocks. The very first roadblock means that unfortunately many of the secondary school students do not choose biomedical sciences for their future. They choose plenty of things, but they found it too difficult. So what we need to do, we need to attract young people to become scientists. In secondary school levels, there are not many laboratories and places to enjoy biomedical sciences, so we also need to establish these kind of systems. Of course, those who are found talented in secondary school, we need to make a bridge between the secondary schools and universities. But there is another low roadblock because at the university, the scientific activities are not compulsory to learn the scientific methodologies. And this is the same at healthcare professional training. If you look at now what is necessary to be a gastroenterologist, immunologist, or cardiologist, there is not inside the curricula that you have to understand the newest scientific ways. So as you can see, unbelievable huge amount of roadblocks from the question until this community benefits. So what I would like to wish all of you that who are at the implementation side, that try to do every effort for our community benefits by implying the newest data. And of course, if you would like to be successful, the road is always under construction. Thank you very much indeed.